Hi, my name is Lindsay Mann, and this is my project on Lyme disease and some overall education about the condition. So, first up is the table of contents. So, I'm going to be talking about an overview of what Lyme disease is, as well as its prevalence, and then getting more into the pathophysiology behind the disease, as well as the signs, symptoms, and the different stages they go in, as well as how to diagnose and manage the condition, educational tips, prevention strategies, and community resources as well. So, a quick overview of what Lyme disease is. It is a complex bacterial infection that is spread through the bite of a tick, more specifically through the saliva of the tick when it bites the host. And it is more prevalent in the Northeast, Mid-Atlantic, and upper Midwest parts of the United States. Over 89,000 people in the US were diagnosed in 2023. As you can see in the graph on the left from the CDC, it shows that over the past few years, there's been a steady increase in prevalence. They are not sure, though, if this is due to just more access to testing or if people are actually getting Lyme disease more often. It also occurs more in males and it peaks in the months of May through August. And it's important to note too that only black-legged or deer ticks can spread Lyme through their bite. No other types of ticks can spread Lyme. So let's get into some of the pathophysiology behind the disease. So it's transmitted, like I said, specifically through the tick's saliva, and the specific microorganism that's involved is called Borrelia. And there's different types, different strains of Borrelia, but that's kind of the main organism involved in Lyme. So Borrelia lives inside the gut of the tick, and it has these spirochetes that are part of it. And what happens is when it bites the host and the host's blood comes into contact with the tick, it triggers the spirochetes to become proliferate. And when they start to proliferate, it releases a protein called outer surface protein C. And that protein, once that is expressed, it allows the spirochetes to kind of move from the tick's gut up into its saliva and then get released through the bite when it's attached to the host. And because this process is so complicated, that's why people can't get Lyme unless the tick has been on them for a minimum of 15 hours. But usually they say closer to 36 hours or more is when it transmits Lyme disease. And then within the host, that starts an inflammatory response with macrophages. And some people are able to just clear the virus and not have any symptoms. But some people that are more immunocompromised or have differing immune systems, they may not clear the disease as easily and they may end up with more symptoms. So these are just some signs and symptoms by the different stages. So 1.6 to 7% of individuals actually may be asymptomatic and not experience any of these, but it usually starts off in the early localized stage, and this is the first about a month of the disease. And you see the classic erythema migrans, which is the bullseye rash pictured below, where it has the dark center and then the concentric rings around it that get lighter. And you usually see this at the bite of the tick, and the rash can expand up to 20 centimeters if it goes untreated. You also see a lot of flu-like symptoms, so like low-grade fever, myalgia, neck stiffness, headache, vision changes, all of those. And then 3 to 12 weeks after infection is the early disseminated stage. And you see persistence of these flu-like symptoms, as well as cardiac concerns like dyspnea, chest pain, and palpitations, as well as CNS involvement. And there's a common triad of meningitis, cranial neuropathy, and radiculopathy that people may experience, as well as Bell's palsy and other ocular concerns like conjunctivitis. And then in the later stages, months after development, you get into more complicated conditions. So you see further neurological and musculoskeletal complaints, as well as more cognitive defects like memory loss, personality changes, and overall confusion. Some people see more joint pain with stiffness and swelling, mainly in the knees and larger joints. And some older women have reported experiencing a condition called acrodermatitis chronica atropicans, which is like these reddish, blue, dark rashes all over the hands and the trunk. So, for diagnosing Lyme, it's mainly based upon the patient's history if they come in knowing that they had a tick bite or that they were potentially exposed to a tick. But actually, only 25 to 30% of patients in the early stages recall having a tick bite. So, a lot of times it can go undiagnosed if you don't notice the actual tick itself. So, some different lab values to look out for. You might see increased ESR, leukocyte and CD3 and 4 counts also might be normal or elevated. But the main gold standard for testing is the ELISA test and the Western blot. So you start with the ELISA or the enzyme-linked immunosorbent assay. And if that comes back positive, then you move on to a Western blot, either an IgM or an IgM plus IgG test. And if both are positive, that's diagnostic for Lyme. And there's no retesting of cure indicated because you can still test positive for Lyme months or years later. And they do both of these tests through blood draws. And some people may also need EKG, CSF analysis, and imaging, depending on what other symptoms and what other systemic complications they're experiencing. For management, the sooner treatment is started for Lyme disease, like many conditions, the better the outcomes are for patients. So for erythema migrans, the bullseye rash, which is the main symptom, you start on doxycycline 100 milligrams twice a day orally for 10 to 14 days. But it is contraindicated in people under the age of 8 and people that are pregnant. So for those people, they recommend alternatives like amoxicillin, 500 milligrams orally, 3 times a day for 14 days, or cefuroxime, 500 milligrams orally, twice a day for 14 days. For those who have joint pain and flu-like symptoms, just supportive care is recommended. Heating pads, NSAIDs, physical therapy, rest, hydration, narcotics if necessary. And it's important to avoid medications if you can, such as benzos, proton pump inhibitors, anticholinergics, opioids, and antihistamines, because they've all been proven to exacerbate some of the neurocognitive symptoms. For general education, I wanted to touch upon tick removal, as you can see in the pictures below. So if you are removing a tick, definitely use a pair of tweezers. Do not use your fingers and try to grab as close to the skin as possible, grabbing the tick by its head or its mouth. And you want to pull it up firmly. It's a common misconception that you want to kind of twist or shake the tick off, but that can actually cause it to burrow deeper. So you want to pick it up firmly and kind of pull it out straight. As well, it's important to know that even if a little bit of the tick stays in the skin, that's okay and it will fall out on its own. And also to not use hot matches and lubricants and other things that are going to irritate the tick because that's also going to cause it to just burrow deeper. And then afterwards, you can put it in a secure jar or bag, and you can also make sure to cleanse the site with rubbing alcohol. And if you develop any symptoms after removing the tick, definitely contact your healthcare provider immediately. You should be keeping a good history of where the tick was located when you found it, how long it was attached, and progression of any symptoms if you develop a rash, when you developed it, and if it's grown over time. As well, it's important to monitor symptoms closely with your doctor because a lot of people who are diagnosed with Lyme experience complications after they're treated for Lyme. It's not a specific separate diagnosis yet, but there's a lot of medical research and information about possible complications of Lyme later down the road. So it's important to just kind of keep monitoring your symptoms if you are diagnosed. For prevention, insect repellent is obviously the biggest thing, especially when you're outdoors. The EPA, Environmental Protection Agency, recommends specific types on their website that you can look at. They like ones that contain DEET, lemon eucalyptus oil, and other beneficial ingredients that actually help with warding off ticks. As well, you can buy permethrin clothing spray online, and that can help to ward off ticks as well. And you can spray it all over your clothing before you go outside. Definitely take caution if you live in regions where Lyme disease is endemic, like I mentioned earlier. Showering as soon as you come in from being outdoors and doing daily chick checks is so important. That's the best way to kind of check yourself and make sure you don't have any. A lot of common spots for ticks to be that people miss are the armpits, the scalp, behind the knees, and in the groin area. It's also recommended that if you come in from being outside and your clothing is dry, that you put it in the dryer on tumble for on high heat for a minimum of 10 minutes because that high heat will kill the ticks if there's any kind of lingering on your clothing. As well, if you can just avoid wooded areas with tall grass in the summer, I know it's really difficult for people, but if you can avoid wooded areas at all possible, and if you can dress in layers, that's very beneficial. And then this is just a non-exhaustive list of some resources that are available. The CDC, Center for Disease Control, is awesome with providing guidelines on Lyme disease, including prevalence, manifestations, occurrence, and prevention strategies, as well as the American Lyme Disease Foundation, which provides information, resources, and support for those suspecting or diagnosed with Lyme. And they also have a lot of information about new research coming out about different vaccines they're trying to develop, and it's very regularly updated. Same with LymeDisease.org, and they're kind of more focused in on the research and the scientific advancements within the disease, as well as different specialists within the field. And that is my presentation on Lyme, and these are all of my references. Thank you.